Hello, my name is Jeremy with Faithful Guardian Training Center, and today we're going to be talking about lung sounds and what they can mean. So first off, you have to know the upper and the lower airway. The upper airway goes from your nose and your mouth all the way to your larynx, which is your vocal cords. And your lower airway goes from your larynx, which is the bottom part of your vocal cords, and your trachea, all the way down to your alveoli. Now, the upper airway sound that we have to worry about is going to be stridor. It indicates you have constriction of the upper airway. This could be from swelling, this could be from an obstruction from a piece of food, a toy, a piece of candy, just about anything that is going to make the airway smaller. Now, stridor sounds like a whistle. If you can think about how people make the whistling sound, where they constrict and purse their lips into almost symmetrical circle and pass air through it, and it'll create that musical tone. It's the same concept. Now you have that exact same thing happening that happens at people's lips when they whistle to the back of the throat, and so therefore it's going to make a musical sound that's going to sound like a whistling. It's going to be very consistent, and you can hear it on both inspiration and expiration. Now, lower airway, again, that's from the bottom of your larynx or your trachea, all the way to your alveoli. Now, the first sound we're going to worry about is going to be wheezing. Wheezing is like stridor in a way, where it indicates constriction of the airway. Now, again, it creates a symmetrical constriction, and it's typically due to a bronchospasm, and you'll see this in asthma attacks. So the way that it creates that musical sound is constriction of those of the airway, and as air passes through it, it just kind of creates that pitch that we hear, and you can hear on inspiration and expiration. It's relatively consistent and musical. Now, we also have rales and we have bronchi that we have to worry about in the lower airway as well. Now, your lower airway, at the smaller part of your lower airway, which is going to be at your alveoli, we have to worry about something called rales. What that means is we have fluid that is inside of our alveoli, and you can kind of compare it to if you were to have a straw in your drink at a restaurant and you were to blow air into the straw, you would be creating bubbles inside of that cup. The exact same thing is happening inside of your airway, inside of your lungs, at the level of your alveoli in rales. You have air that is passing over fluid and attempts to make it across the alveolar capillary membrane to oxygenate your blood. You will see this with drowning victims, and you will also see this with people who are presenting with left-sided heart failure, or what some people like to consider cardiac asthma. And it, again, is just fluid accumulating inside of the alveoli, which is going to be the smaller part of the lower airway. Now you have rhonchi. Rhonchi is mucus, and it can sound a little bit similar to wheezing in a way, but it's more inconsistent because it's not a very consistent constriction. Rhonchi is mucus in the larger airways of your lower airway. Now, this is going to be your bronchi and your bronchioles. And what happens is you just have this gunk that starts to develop inside of your lungs, and it's kind of similar to having a sinus infection, where you have all this mucus that's built up inside of your nasal cavity, and you breathe in, you breathe out, and it just sounds like an inconsistent crud, air passing over the mucus, and it's not very pleasant to listen to. The exact same thing is true of bronchi in your larger airway of your lower airway. So upper airway is going to consist from your mouth to your vocal cords. Lower airways from your vocal cords to your alveoli. Upper airway, we have to worry about stridor, which is musical, and it indicates an airway obstruction or airway constriction at the level at or above the larynx. Then we have our lower airway. We have wheezing, which is a constriction of your bronchi and your bronchioles. You have rales, which is fluid in your alveoli, and then you also have rhonchi, which is mucus, and it's inconsistent sounding. Those are your airway sounds.